So my name is Pundrique Sharma, and I'm a consultant plastic surgeon in Merseyside in the Northwest. So a typical cosmetic surgery consultation will actually be surprisingly in many regards similar to any consultation that you'll have with another doctor, your general practitioner. The main differences are firstly that it's a bit longer than you would have otherwise in general. And also very often patients are a bit more nervous, and that is, I think because patients are coming for something they feel awkward about, and they've been worried about for a long period of time, and not quite sure what to do about them, why they come and see us. So the initial part of the consultation is very much about trying to put the patient at ease in themselves. So I think that's a big part. A lot of the rest of the consultation, in terms of what we're aiming to do, is about setting expectation so that the patient can express what their expectation is, like how they feel they would like to look, how they want to change things. But the surgeon also expressing how they can realistically achieve that expectation. And it's tremendously important that those expectations match one another within a range. So that is the next part of it. And I guess the third component to it is very much a case of learning or checking that we're comfortable with each other. I have to be happy that I think that the patient is somebody who trusts me, and the patient has to feel that they do trust me. And I think that is critical for any doctor-patient relationship. And that's the aim of the consultation. Then in terms of how it actually works, it's as I say, very similar to any standard consultation you'll have. There'll be a discussion about why you're there, your general medical background, an examination, followed by a recommendation. That's how the first consultation will work. Now, the next part of the question is how you can prepare for the consultation. I think most patients are pretty well prepared these days, thanks to the internet. In fact, there is a danger of over-preparing. So I think the most important thing you can do is know what the best sources of information are beforehand. So the things that I would recommend are, for example, the BAPRAS website. So that's the British Association of Plastic, Reconstructive and Aesthetic Surgeons website. That's bapras.org.uk. And they have a lot of very objective and well-written, easy to understand patient information. So I would recommend that. And I think the other source is probably friends and family who've had cosmetic surgery. Get an idea from them of how it went and what their recommendations would be. I think that's probably the other way that you can prepare, because over-preparing can actually make people, I think, unnecessarily nervous and give sometimes false expectations as well. So it's not just a one-way street about the patient having their candidacy assessed, but it's also the patient working out whether the surgeon is right for them. And that's very much a case of developing trust and understanding. So the first thing I think both the patient and myself are trying to work out is whether we have a good doctor-patient relationship. That is absolutely essential before proceeding down a course of treatment. The second thing that we're looking at is expectation. So the thing I'm worried about is that the patient's expectations won't be met, and it's actually the thing that the majority of patients are. So the way to check that that's going to happen is to find out what the patient's expectations are, what their range of expectations are, the range of results that would make them happy, and make sure that I can match that and to give them an idea of what sort of results they can expect. Ultimately, we should be expecting essentially the same outcome from the same intervention. Okay, and then the final thing is less often a problem in the cosmetic surgery patients I see, and that's general medical or other issues that mean that engaging in a course of surgery would somehow place the patient at significant risk of life or limb, for example. So we do have to be, we have a duty of care to our patients, that means that we're doctors before we are cosmetic surgeons, and we have to take that very seriously too. I think the most important things are questions about expectations. So if I was a patient, what I would want to know is, what results do you as a plastic surgeon think you can achieve? How reliably can you achieve it? And also, how long will it last, right? Because some of the surgery we do doesn't last forever. It will change with time. So that's the first thing. I'd also want to know what the risks are. I think that's an important thing. Now, a lot of this, the surgeon should be volunteering as they go through, but certainly I would want to know that as a patient. And I'd also want to know about the post-operative care and the post-operative management. So those are the groups of things that I would want to ask. Now, the other question is, how do you ensure a positive surgical outcome? Well, actually, it goes back to the first part of the question. It's again a case of expectation. So the most important thing is that the surgeon and the patient are both singing from the same hymn sheet in terms of what's going to happen and what we expect the result to be. That is probably the most important thing. So how do you evaluate your plastic surgeon? So I guess I would ask myself, what would I want to know about a plastic surgeon if I was going to see them? So that begins before the consultation, really. So checking what their credentials are, checking they're registered with the GMC. Plastic surgeons will usually be on the specialist register for plastic surgery. So that can be found on the General Medical Council website. Organizations, membership of certain organizations such as BAPRAS, I think are very important now, and the Royal College of Surgeons. These things don't guarantee a good surgeon, but they're an indicator. They put you in the right direction, because these organizations have a reputation to protect, and they generally won't have people who don't meet certain standards within them. So that's what I do beforehand, as well as, obviously checking internet reviews, and which can be a bit biased. I'm always mindful about that, and talking to patients, if you can, who've had the procedure done by that surgeon. Word of mouth is obviously, I think, very, very important. During the consultation, there are lots of things to look for. Do you feel that they're listening to you? Do you feel that they understand your expectations? And do you think that they can deliver those expectations, as evidenced by what they say, but also by what they show in terms of past results? I think that's what I would be looking for. But even more important than that, I think, is that intuitive feeling about, do you trust this surgeon? And they will be doing the same with you. They'll be thinking, do I feel comfortable with this patient? I think that is probably actually the most important thing.